We're pleased to both have it in publication and as a poster here at the IMS meeting, our phase 2 randomized study of digital life coaching versus wellness handouts in patients with myeloma undergoing transplantation. So supportive care is, I think, a big deal for our patients, and I think it's something that we as physicians are aware of, but not something that gets a lot of research in terms of how do we help patients rebuild their lives after transplant and make them feel better faster and feel better than they did before diagnosis faster. There have been RCT, randomized controlled trials, that have been done, which have all been great, of music therapy, acupuncture. There was a study by an Icelandic group of programmed room lighting, like bright lights during the day versus dim lights. There are great interventions that have been shown to improve patient mood or patient pain or patient quality of life, but they're very resource intensive or hospital specific. Like, it's very difficult to take that program room lighting experiment and bring it back to the patient's home once they leave the hospital. And so what we were interested in is, what if we give patients access to a life coach? So not a doctor, not a nurse, but a certified health coach who can just talk to them by phone, by text about wellness. Whatever the patient wants to talk about. That could be sleep, that could be diet, that could be physical activity, that could be stress about returning to work. All of that, any of that, and that can change from week to week depending on whatever's stressing the patient out, whatever's not letting them, live their life. How can we help with that? And we've done a previous pilot study that showed that it was feasible. So again, what we do here with this curriculum is we actually have patients get paired with a real human being life coach, not employed by our hospital, in a different state, that can call them, text them, and even during transplant, patients worked with a life coach on average about once a week in our pilot study, even while hospitalized. And so we said, all right, well, if it is feasible, let's see if it actually works. And so we did a phase 2 randomized study funded by an ASCO Young Investigator Award during my fellowship of basically wellness handouts, just to kind of give everybody some attention to their wellness and how they're feeling, but randomized to either just get the wellness handouts or also have access again to this 3-month life coaching curriculum beginning at day -5 before transplant. It was a challenge during COVID to get the study to happen. We made it happen. We were able to accrue 50 patients who were randomized to basically either digital life coaching versus the wellness handouts. And we did find, which was very happy to see, an improvement in physical quality of life at the end of treatment, or longitudinally, I should say. So during the 3-month curriculum, patients who got the life coach felt better about their physical quality of life in terms of how much they were able to walk, how much they were able to participate in daily activities, and so forth. We saw a borderline trend towards improved psychosocial distress as well. Like, it was just shy of significance. I do think it was real. Our study was actually underpowered because of the pandemic, but I think that was real. As an example, at the end of the 3-month study period, in the control arm with the wellness handouts, 28% of patients still reported elevated distress, a score of 4 or higher on the distress thermometer. In the life coaching arm, there's only 10%. So I do think that some of these coaching tips and the longitudinal accountability of the coaching seem to make a difference. We didn't see any differences in mental quality of health. We didn't see any differences in terms of drug usage for anxiety or sleep. But I think this was enough for us to show that this life coaching technology, I think, is nice. One, because it works. It makes patients feel better about their physical quality of life, likely improves their stress as well. And 2, it's very scalable. This technology, digital life coaching, just being able to text and call a life coach the way that you would text or call a loved one, whether you're in the hospital, whether you're in clinic, whether you're at home, is wonderful. Technically, that could, any center can implement this, right? Because you don't need to hire the coaches. They're already there, just kind of getting the program set up. And so based on this and the positive results from this study, we're now doing several other studies elsewhere in the myeloma continuum. So what we're working on now is a 100-patient study of digital life coaching paired with a Fitbit. So now we're trying to see that, studies have shown that if you just give a patient a Fitbit, a wearable activity tracker, and just say, here, use this, it doesn't really work, which makes sense. You just give someone a gimmick, it's not really going to change how they approach their life, especially because they're actively fighting cancer and doing everything around cancer. But if you kind of combine the accountability that a life coach provides with saying that, hey, you said you're going to walk 100 feet today, or 100 or 10,000 steps, let's make it happen, with the actual data from a wearable activity tracker, and put them together, there may be some synergy there to really help patients, again, rebuild their lives, feel better, walk more, move more, feel better, and we're excited about that.